Hi, and welcome back to Hill and Ponton's Veterans Disability Blog. I'm Natalia Jofre, the company's COO.
And I'm attorney Linscott.
So today we're going to be talking about VA compensation and back pain. This is
super common.
Yeah, it really, really is. So we're going to get a little bit more into the nitty gritty. So, Anne, can you tell us what some of the common conditions are that cause back pain?
So there's a lot of different diagnoses, some of which I probably can't pronounce correctly. Degenerative disc disease, degenerative arthritis, spinal stenosis. There's a whole range of them. Regardless of what the diagnosis is, if you're filing a claim, as long as you're writing back pain, and ultimately your medical record shows some formal diagnosis, then the diagnosis itself doesn't matter as much. So referring to it as back claim or back condition is a lot more
concise and common, and that's okay.
Yes.
Yeah, you don't have to get into it. Okay, gotcha. Are there some conditions that are more common than others, or certain occupations in the military service that lead to back conditions or back pain?
I would say as far as common conditions, degenerative disc disease and degenerative arthritis are probably some of the most common. They're all fairly common, any kind of back pain.
Right.
MOS, as far as, the number one thing that I automatically think of is paratroopers. You're jumping out of helicopters, hard impacts, frequent jumps, but really any kind of job in the service, you're wearing heavy gear, you're wearing gear that overall can weigh 50 pounds and over just of itself. So you'll see a lot of back injuries that happened in basic training or some kind of physical training just throughout service. It doesn't have to necessarily be one injury. So it could be kind of just general,
like progressive?
Right, as long as it's happening in service. Right.
So maybe like with your example of a paratrooper, maybe it wasn't one particular jump that caused the injury, but perhaps, 100 lands later you have herniated discs.
Exactly.
Or degenerative disc disease or something of that nature.
Yeah.
Okay.
So it could be one injury in service, one specific thing happened. You twisted your back playing basketball in service, or there was that one jump where you injured your back. Or it could be a combination of just the wear and tear of wearing that heavy gear, or the wear and tear of multiple jumps, things like that.
And like we've discussed before, it's important to remind everyone that the back pain or the back injury does not need to be directly correlated to your being in combat or to, some kind of military exercise that you were, performing at that time.
Right.
That, if you had a car accident and as a result of that, you ended up with, some kind of back pain or whatever.
So similar to the basketball example, it doesn't have to be something that you're doing related to your MOS, as long as it's not part of willful misconduct. So as long as you're not, drinking too much when you shouldn't have been drinking, things like that, which is a whole nother rabbit hole. A car accident is another good example.
Yeah.
You could be driving, you're on active duty, and just because you're not, on a mission doesn't mean that it's not related to service.
And it's still covered just the same.
Right.
Rated just the same.
Right.
Okay. Are there any secondary conditions related to the back conditions?
Yeah. So with back conditions, similar to really any orthopedic condition, secondary issues are a big thing. The back, you'll see a lot of nerve problems related to it. So radiculopathy, the pain, a lot of veterans will call and say, well, my back really hurts and I've got shooting pains that go down my legs or, shooting pains up into my neck, things like that. That is, indicates nerve pain. And if it's directly because of your back condition, then it should be service connected as well.
Okay. So neuropathy, basically.
Right.
Yeah. Okay. How does the VA rate back pain?
So back conditions are a tough one, and they're tough because of how limited the rating criteria is for back conditions. It focuses heavily on range of motion, which doesn't always kind of get the full picture of everything. So We have a veteran that comes to us and says, 20% or I'm 40% for my back. That, even though it's only 40%, it's not 100, automatically I'm thinking, okay, they probably can't work. I mean, that's some significant limits and probably some pain. So the rating criteria, it's on the schedule of ratings for the musculoskeletal system.
Mm-hmm.
There are one thing associated with back conditions a lot is called intervertebral disc syndrome, or IVDS, which is a lot easier to say, is something that's very common with back diagnoses. It is a diagnosis. You have to have medical records showing you have it.
Right.
There's a separate rating code for that. So if you have IVDS, which is measured, the ratings are measured based on incapacitating episodes, basically if you can't do anything.
Mm-hmm.
If that would give you a higher rating than the rating criteria for, let's say, the degenerative disc disease, which is based on range of motion, then the VA should go with a higher rating. So the ratings can get super tricky, and a lot of times when we're looking at a veteran's back rating, ultimately to get the highest rating, we're looking at going for individual unemployability.
Okay. So you're talking about the ratings and all of this and what they're going to consider. What should you do to prepare for a back pain compensation and pension exam?
Compensation and pension exams for any condition can be tricky or frustrating. Back conditions, especially so because of how just the nature of the exam. It's one exam, it might not even last an hour. So this examiner is having to consider your whole history. You might be getting examined on a day where you're having a good day. While pain can be chronic, there's some
days are better than others.
So it's really important when you go to that exam, if you are having a good day, you need to explain to that examiner any flare-ups you have. Think about what your pain and what your limitations are on your worst day, because the rating that is assigned, it needs to encompass the whole picture, so not just that day.
Yeah, I think that's important, because normally when people are being asked, well, where would you rate your pain, and do you have this or that? And I think that one of the mistakes that people sometimes make is they'll say, well, I'm feeling pretty good today, or today's not a problem, or today I would rate my pain at a 2, but if 25 out of the 30 days in a month your pain's at an 8, don't talk about the day that your pain's at a 2.
Exactly. And unfortunately with C&P exams, the VA, if a veteran says, oh, I'm doing great today, they may try to use that to decrease
They're going to write down
rating.
The veteran is doing great.
Right. And so being honest is a big thing to do. Also, you're going to have range of motion testing. The VA will always use what's called a goniometer. And that is important to note if you're having any range of motion testing done not through the VA, because it has to be done using that method, or the VA will consider it.
Okay. What are some common issues that you see with back pain claims?
I would say definitely just the ratings themselves. Like I said, the range of motion testing, C&P examiners, they are supposed to measure when you start to feel pain. So it's not, are you able to bend this far? It's, when does the pain first start?
When does the pain start?
So ratings are going to a lot of times be, the VA is going to lowball you on your rating. They might, unemployability kind of coming into the picture again, they might not do what they should as far as referring your case for that consideration. So the C&P examiners should take into account flare-ups, like I said earlier. So all of that, they'll hyper focus on that range of motion and not consider anything else.
And with that in mind, because, with a lot of our veterans, they're, they learn and are told to, suck it up, don't complain, this is the time to complain.
Exactly.
And like you said, if they're gauging you based on when you start feeling pain, don't think, well, I can go this far, and that's as far as I can make it. when they're telling you, tell us when it starts to hurt, make sure you vocalize that.
Right. And there's been times where we have cases, you know, the C&P examiner notes range of motion is one thing, and then talking to the veteran, they say, well, the examiner asked me to go further than I really felt comfortable. You know, I let them know it hurt, and that's not reflected in the exam. That's something where, you know, putting that in a written statement can be helpful to have a doctor comment, again, on the whole picture and not just that exam. That
one aspect of it. So you mentioned rating. Can a veteran get 100% service-connected benefits just for back pain? And I don't mean it that way. I mean, I know that just back pain can be completely incapacitating. So I'm not minimizing it. But if that were their only condition or complaint issue, yes.
So yes, there is a scheduler, which means the 100% rating comes from the rating criteria. I, to be honest, don't know if I've had a case where a veteran was actually 100% for their back.
Really?
More common, you're going to see the 40%, 20%. If the veteran has 60%, you know, and I'm usually pretty shocked that the VA hasn't given him something higher. So 100% for your back condition, a lot of times is much more realistic to go through the unemployability route. So that means you are 100% disabled due to your back. So technically you'd be 100% for your back, but that way you're not limited by the VA's rating criteria for back.
So is that otherwise known as TDIU?
Yes.
Okay, and that's temporary
total disability based on individual unemployability.
Okay, so that, if you are approved, so you can be approved for TDIU for back pain.
Yes.
And that benefit would basically equate what you would get if you were found to be 100% service connected.
It'd be the same amount of monthly benefits. It's the same for any miscellaneous benefits. There's kind of two ways to the total. So with back claims, so even if your back claim or your back condition is the only service-connected condition that you have, and it's, let's say you've been fighting and fighting, you can't get higher than 40%. If you can't work because of your back, then you should definitely, if you haven't already, apply for TDIU, because regardless of if that 40% rating goes up, if you're granted the TDIU, you'd be considered 100%.
Wow. Okay, great. Thank you, Ann.
You're
Super
welcome.
helpful. If you have any questions, please feel free to visit our website or call our office. Otherwise, we hope you'll join us again.
Thanks.